Hello.
Hi, is it better now?
No, I might
No?
have to not use my headphones.
Okay.
Let me see.
Is that like going to work? I'm not sure if that's gonna make it
This
harder
is
for you.
better. Yeah,
Okay. Sorry about that. I'm not sure what I can do to help.
that's
Um,
okay. No worries. It's not your fault.
um, but yeah, we're also, if it's okay, gonna like record the session just because some people like to watch afterwards,
Of course.
just to look back. Um, and I see we already have someone here, Sarine. Hi. We are gonna
Hi.
give people a couple more minutes to like trickle in because
Sure.
people are oftentimes late, or I'm gonna send out like a little reminder message right now.
No worries.
Recording in
All right, guys, I'm gonna give it about a minute or two just for anyone else to trickle in, maybe, and then we can get started. All right, guys. So I'm gonna introduce our speaker just so we can get like slowly started, and then people can trickle in with time. So I'd like to thank you all for joining in on our event. I'd like to introduce you to Arjina Boodaghian. She is a graduate of UC San Diego. She got her bachelor's in science in biology, and she minored in psychology, and she continued on to Western University of Health Sciences, where she became a doctor of osteopathic medicine. So she does have her DO degree, and she's going to be talking to you guys about her journey through undergrad, medical school, and now residency, because she is an OB/GYN resident, first year, I believe. And so she's just going to have an open and honest conversation. Questions are welcome along the way. We'll also have a Q&A session towards the end. But I do believe that Arjuna does have like a presentation with slides prepared, or she'll share her screen, I believe, and she'll lead the talk, at least for the first part. So if no one has anything else to add, I'd like to give the floor to Arjuna.
Hi, everyone. Thank you for having me here today and for inviting me. It's really nice that you guys are doing this and you have this organization. When I was in school, I did not have this, so it's pretty awesome what you guys are doing. So it's really appreciated, actually. So I'm gonna share my screen, but David kind of already talked about my first two slides, actually, which is also just my introduction. So we can quickly go through that. And feel free to ask any questions along the way, interrupt me, and we can also just have a Q&A later on at the end. So yeah. So this is my journey. I am an OBGYN resident currently at Santa Maria Marion Regional Medical Center. So it's a small community hospital about 3 hours north of LA. So I'm kind of pretty lucky that I got to stay in California. And then this is kind of what we're going to talk about: undergrad, pre-med background, medical school and journey, residency training, what it entails, and then we'll do Q&A. So like David already mentioned, I got my BS in general bio with psych at UCSD, graduated in 2016. I did take a gap year after I graduated, and then I started medical school in 2018 at Western U. And then once I was done, I just recently started my OBGYN residency in, like I mentioned, Santa Maria. It's a 4-year program, so I have 3.5 more years to go. So undergrad, so I know a lot of you guys already know this, the pre-med recs. So I started doing my pre-med recs during my first year. I didn't really know if I wanted to go to med school, but I just thought, you know, I really liked bio in high school and I wanted to major in that. So it kind of just happened. So you have to do 1 year of bio, gen chem with lab, or chem with lab, physics, math, and 1 course of biochem. If that's changed at all, please let me know, because it's been a while. So if you went straight from high school to college, then you might have had some AP courses. I got to test out of biology 1 year, which was great. And I believe one block, I don't even remember, 1/4 of calculus. So the rest I had to do at SD. So I got all of that done. I did a little bit of research. So I had some clinical experience, extracurriculars. So I did some research at the Scripps Research Institute in cancer. And then I had some experience with Flying Samaritans. So that's just an organization we had at UCSD. I don't know if you guys have it at UCLA, but basically it's a group that gets together once a month and goes across the border to Ensenada, Mexico. We have our own clinic there with UCSD Medical School, and we would just work with the doctors there, treating the population of Ensenada. And I shadowed some doctors. I honestly don't think I had enough clinical experience. I wish I did. I wish I did some scribe work. I really, like I mentioned, wasn't too focused on going to medical school earlier on when I started. So, and I really didn't have a lot of knowledge and background on what I needed to do to kind of pursue that route. And I also had a lot of leadership positions, which I'm really grateful for. I joined AGA. I know there's a chapter at UCLA, some of you may be familiar with, and I basically held all the positions of AGA throughout my 4 years. I was part of ASA, had 1 position there, MGC, which is just like the overarching group of the, the sororities. And Flying Sams, I also held a position. So I think that really gave me a good leverage, because even though I didn't have enough, let's say, clinical experience and even research experience, I don't think I had nearly enough compared to other people. I think just my experience with leadership alone kind of gave me a pretty big boost, and a good enough knowledge of just, I got to realize who I was, how I was able to deal with difficult situations and come up with solutions. And I think you really need to develop those skills earlier on. And so if you're able to do that in undergrad, even better. So timeline to apply to medical school. Again, some of you might know this, I did not. So I appreciate you guys doing this. So if I had this back then, this would have been really helpful. But this is only if you want to apply to medical school right after and start right after undergrad. So you have to get your prereqs done by the end of junior year, take your MCAT the summer between junior and senior year, and then apply in senior year. So I didn't do that. I did finish all my prereqs by the end of junior year. but I didn't take the MCAT until I believe it was second half of my senior year. And I didn't do well. I didn't do well on my first MCAT. And it was really devastating because, you know, you worked so hard, you tried so hard, and then you don't get the result that you wanted. And at that moment, I realized that I needed a break. I needed a mental break. I needed to kind of figure out what I really wanted to do. And so I took a gap year. So I took one gap year. I didn't go to school, medical school, right after undergrad, and it's okay if you choose not to go as well. The average age of med students that start is 24 years old, and that's how old I was. And half my class was that age, basically the average. So I took a gap year, and then I started a research project at USC, and then I kind of ended that a little early because I really realized that it wasn't what I wanted to do at all in any sense, and it just wasn't making me happy. So I stopped that. I got a job at a diagnostic lab. I worked there, and I honestly just enjoyed my time off. It's 1 year, one gap year, but it technically ends up being 2 years because I didn't apply when I graduated UCSC, which was in 2016. So I waited the next year, following year, which was 2017, and then I got in 2018. So you got kind of like a year and a half to 2 years off, and it was the best time. So I highly recommend taking a gap year. It really makes you grow as a person. You get some adult life experiences. You kind of get to figure out who you are, and just you go into med school a little bit more understanding of what you want to do, and just you have a better understanding of your goals. So if you're able to do that, highly recommend it. So med school. Okay, applying. Whether we like it or not, med schools do look for applicants with good GPAs and MCAT scores. I took my MCAT twice. The second time around was better, thank God, but the first score I didn't void, so it still is visible. And this was right when they had switched over from the old scoring system to the new scoring system. So everyone was still kind of getting used to this. So you can have a good GPA and your MCAT score can be which is what mine was, but you still need to have other things that boost you up. So they want a well-rounded, personable, ambitious person. So they don't want a robot, because there's so many people that are out there that know how to study, that know how to get straight A's and get a 520 on their MCAT. But that might be all that there is to them, unfortunately, or not. But you have to be able to show medical schools that you're so much more than that, and that you're able to do so much more than studying, because they want to see that you're going to be an empathetic and caring physician. You still have to know what you're doing, and you have to have studying skills, which is what the MCAT is really for. They want to know if you're able to study, and if you are able to tolerate an 8-hour exam, because you're going to have to do it over and over again. But that's really it. There's no other point to the MCAT except to weed you out and to prove that you can study. But if you're a personable person, if you are able to get along with people, if you're an empathetic human being and you're able to show that during interviews, that goes a really long way. You also have to know your why. So you have to know why you want to go to medical school. What is it that you want to do? What's your end goal? I kind of was lucky to figure out my why midway of my undergrad year. And I actually knew that I wanted to be an OB-GYN at that time, because I took one reproductive health class at UCSC, and it kind of clicked. And I was like, this is what I want to do. So I was going into medical school just to be an OB-GYN, and there was like no other reason. I did not want to be a family med physician. I did not want to be any other type of physician but an OB. So if I knew that that wasn't possible, I honestly wouldn't have gone to medical school. But you also have to figure that out for yourself and what your goals are and what your why is. For interviews, you have to be yourself. They can really tell when someone is faking it. We can tell too. I'm starting interviews for residency programs. I'll be interviewing applicants starting this week, actually. And so I'll even get a better idea of how applicants are on the other end. So you really have to be yourself, be honest, and you'll do great. You have to look for programs that support students, especially during your third year and fourth year of medical school, which are your rotation years. You want schools to be able to support your goals, to be able to place you in locations that are going to support that, and you'll be able to reach your goals. And if it's really hard to tell, honestly, during interviews, especially now, because I'm guessing it's still over Zoom. Mine wasn't, and I still had a hard time telling because everyone puts on a facade. You can't really tell, but as best as you can, try to weed that out. And in terms of choosing where to go, you will learn the same thing academically at any medical school you go to. There is no difference. Everywhere will teach you the same thing and you will still learn it at the same way. However, you're still going to have to teach yourself some things because there's just a lot of outside resources that do a better job, and all medical students use that. So we use Pathoma, we use Sketchy, we use UWorld, all of that. By the way, I heard that there's a UWorld for MCAT now, and I'm really jealous. So you guys have a really good thing going for you. Yeah, so you want to go somewhere that not only is going to be good academically, because you're still going to learn the same thing everywhere you go, but you want good support system and a program that's going to have good mental health support as well. Med school's hard, you guys. It's not easy. It's going to take a toll on you. It's on anybody I have come across that's been in med school. It's taken a toll on them, and you want to know that there's going to be resources available to help you out with that. And then I know everybody says this, but I'm going to reiterate it again. Don't go into medicine for the money or the prestige, because that's not how you make money nowadays. You're not going to see a dime for many years. Even as a resident, it's really barely anything. So you really have to know that you won't be making a lot until probably like 8 to 10 years after you graduate undergrad. And that can be hard for a lot of people, but if that's okay with you, then I highly recommend doing that and following your dreams, because if it's your dream, you got to do it. But if you're doing it for the status, the money, or prestige, it's not worth it. And I don't recommend doing that. So what's med school like? It's basically this meme that I put up here. I don't know if you guys can see that, but it really does feel like everything is on fire around you and nothing makes sense. But that's only for the beginning. First 2 years, you start off, you do academic didactics. So you're just in school learning all materials. And then last 2 years, you go out on your rotations. So, and I know I forgot to put this in the slide, but we'll talk about this at the end, or if you guys want to ask me questions about it. But I did go to a DO school, and we can talk about differences between that DO and MD, if there are any differences really nowadays, but we can talk about that at the end. But other than that, academic wise, it's all the same. I learned the same thing as my MD colleagues right now. We're both at the same level. We ended up at the same place. So yeah, those are the first 2 years and the last 2 years. It's very different from undergrad. I went in pretty naive, and I thought that everybody was lying when they said that med school was going to be hard. I was like, there's no way it's going to be hard. I did well in undergrad. I'm going to do well in med school. And it's really different, and it's really difficult. There's a saying that goes, you got to learn to drink from the fire hose And that just means you're basically just getting hit with so much information every single day, and you really have to figure out how to take it all in, digest it, and learn it. You might probably have to find a new studying method. At SD, I usually studied on my own. I was a hermit. I would study in the library for hours on end, and then I would go home. I now realize that that wasn't healthy, and I wouldn't do that. But going into med school, I was like, okay, well, maybe I should try something different. So I started studying with a group the first month. So we would all study in the group, and then we would have tests every single week. I quickly realized that's not my thing. I get really distracted. I am not able to focus on anything if there's anybody around me. So I went back to studying by myself, but I had a better balance at doing that. But that might not be the case for you. You might enjoy studying with other people, and you might do well at it. So it's whatever works for you, but you got to stick with it. Remain focused on your end goals. I can't stress that enough. It's very hard to lose sight of why you ended up doing this in the first place. You're going to go through a lot. It's difficult. It's really hard. And you have to keep reminding yourself why you're doing this. And I know with the world of social media, you're probably going to have friends that are done at undergrad and then they get a job and they're working and they look like they're living a glamorous life outside, but that might not be true. And if I were you, I would turn that off. I would not focus on that, and I would still just head on, look at your goals and continue to follow them, because that's all you can do, really. I really would beat myself up over that a lot, because again, I had friends that were out there living life, making lots of money, and I could have done that too if I hadn't gone into this. And it gets hard. You're getting older and you're like, well, I need to be reaching certain milestones in my life, and I'm not doing that yet because I'm still in school and I'm in so much debt and yada yada yada. And it's just, you go down this rabbit hole of thoughts, and it's very bad to get yourself in that situation, but it happens because you're human. But you have to learn how to pick yourself back up and keep going. You really do have to study every day, and I cannot emphasize that enough. You have to study every day, but you don't have to study like 12 hours a day. You can study 3 hours a day, 5 hours, 7 hours, whatever is comfortable for you and your studying method, but you have to do that because you will fall behind. And if you fall behind, there's no catching up. There really isn't. But you also have to take breaks. You have to find a good balance. Again, I didn't do that. There's so many things I wish I could go back and redo, looking back now, because I burned out so fast in medical school. By the time I was in my second year of med school, second half of second year, I was done. I was about to quit. Like, everything was just horrible because I just would constantly study. I would study 12 hours a day, barely take any breaks and whatever. It was a lot. I did do well in school, but it wasn't good for my other aspects of my life. Sorry, I don't know if you guys can hear, but my bunny is going crazy outside. Yeah, so I regret that, and I wish I could have done that differently. So that's one thing I highly recommend you don't do. Find a good balance. Go out to dinner at least once or twice a week with your friends. Hang out for a couple hours. Go to the gym. Pick up a new hobby, because it's worth it, and you will thank yourself for it later on. And again, prioritize your mental health. At the end of the day, you're what matters. If you're not taking care of yourself and your mental health, then you won't be okay and you won't make it to the end, because it really is a marathon. And it's for the rest of your life, honestly. And you really have to figure this out earlier on. And again, not let anything get to you. Easier said than done. You will probably have to find that out for yourself, but it's something that I should mention. And then I put this under at the end. It's just recommended studying tools, Anki cards and UWorld practice questions. I don't know if you guys use Anki cards. None of this existed when I was in college, which is sad. I sound old, but it really, we didn't have any of this. So if you have access to these, I know UWorld's really expensive actually, but for the MCAT, definitely use UWorld. I would not pay for a course. I did that twice. Wasn't helpful. I could have just done only studied practice questions, and that would be it. You will only be using UWorld and Sketchy and Anki if you're okay with Anki, and a couple other resources in med school to study for your step 1 and step 2. So timeline for medical school. This maybe not everybody is familiar with. So first 2 years, like I mentioned, it's didactics, and then you get to the last half of your second year, and then you have this time off. You study for your step 1, level 1. Level 1 is for DOs at the end of your second year. And also if you end up going to a DO school, you actually have to take both. So I took both step 1 and level 1, and then step 2 and level 2. So that's 16 hours of testing twice. It's a lot. So you do that before you start your third year. So then comes your third year, you start your rotations, and this is when you kind of start thinking about a specialty if you haven't already thought of one. I had thought of one. I was going to go to OBGYN. Nothing else was like, I was only focused on OBGYN. I tried to be a little bit more open-minded, and I was. I kind of liked psychiatry. I liked general surgery a little bit, but OB-GYN was where I was headed. And nothing really swayed me when I did my rotations. So you do that, you collect as many letter of recs as you can, okay? And when you're collecting them, you have to ask whoever you're asking them from if they're gonna write you a strong letter of recommendation. It's okay if you say that, it's fine, they're used to it. Just say, can you write me a strong letter of recommendation? Because these letter of recs really matter so much when you're applying to residency programs. So you get the letter of recs, then you apply for audition rotations end of the third year. Audition rotation, not a lot of people are familiar with this. That's, you pick a rotation that you want to do in the specialty you want to apply to. So mine was OBGYN. I went online, there's this, I don't even know, it's called VSAS, it's online application system. You go in, you look at all these applications of places you want to go. They're also called away rotation. So that means you go away from your school to do a rotation. I did one at Cleveland Clinic. I went there for a month. I did that in OBGYN gynonc. I came back. And then I had 4 more at different hospitals in California. Now you don't have to do that many, but I wanted to because I wanted to be a strong candidate. So that's what auditioning is. You're basically, what the word means, auditioning yourself. It's basically a month-long job interview wherever you decide to go for your rotation. You do that at the beginning of your 4th year, and then you apply for residency programs your end of September of your 4th year, okay? Apply, interview, then it comes match day in March. You match into your residency program, and then you have fun. Nothing else matters. You're done. You don't have to think about anything else, okay? You just forget about everything. You go on vacation, you enjoy your life, because you'll never get this time back ever again. I'm currently on vacation right now, which is really nice. You will get vacation time, but it's very few and rare. So enjoy it while you can. And this is OBGYN. So OBGYN, best specialty in my opinion, because I'm in it. It's a surgical subspecialty, 4 years of training to be a generalist OB-GYN. And then you can subspecialize afterwards. It's about 3 to 4 years of fellowship. You can be maternal fetal medicine, gyn-onc, so many other things I can't even think of right now. Oh, Urogyn, a lot. And then we typically work about 80 hours a week, sometimes a little less, sometimes a little more. It's really great that ACGME put a maximum of hours starting, I believe, in 2008, that residents can't work more than 80 hours a week. Some programs still make you work more than that and log less hours. That sounds like a toxic program to me, so I wouldn't want to be there. But yeah, my program's pretty good with that. I work about 80 hours a week. I take 24-hour calls. So calls means that you're not on call at home, you're on call at the hospital working 24/7. So, well, 24 hours, sometimes more. It's usually about 28 hours and it's about twice a month. So you get 2 full weekends off a month. The 24 hours for OB-GYNs, you actually stay awake for that long because there's so much happening. And it flies by. But for other specialties, you might be able to get some sleep in because no one's delivering in the middle of the night. There's very few like emergent things that happen in the middle of the night for other specialties. Why I loved OB-GYN and why I picked it. It's just such a wide spectrum of patient care. It's procedural, it's surgery, it's primary care. You get both office, primary care. You also get the surgical aspect. You get the hospitalist aspect. There's just so much you can do. My patients literally range from 13 years old to 88 years old. 88 years old is actually my oldest patient I've had so far, which is great. You see so many different things. We do vaginal deliveries, C-sections, high-risk pregnancy care, laparoscopic, abdominal, vaginal, gynecologic surgeries, and so much more. We don't just deliver babies like a lot of people think, and it's not all sunshines and butterflies. It's really difficult actually, and it's very surprising now that I'm in, because it's a lot more high risk than I thought it would be. Especially where I'm training at, a lot of the patient population is high risk. So I think that's why, but if I were to finish and move somewhere not as high risk, it would be fine. But yeah, there's just so much you can do with this one field. Once you're done, you can either focus on one aspect of the field. So you can only choose to do OBGYN and deliver babies, or you can do GYN and do GYN surgeries, or just be in the clinic. That's it. Or you can do it all. It doesn't matter. The choice is yours. So I did that. Oh, I forgot to mention what in undergrad, after I figured out that I wanted to do OB-GYN from that one course, I ended up going to Armenia for 3 weeks with AGA, and I forgot what other program it was. I think it was Hidden Road Initiative when they had just started, and they made a little program. I was the first one to go in Armenia. It was not set up well, but I still went for 3 weeks, got exposure to the field. I was in the hospital for 3 weeks, saw my first C-section, saw my first deliveries, everything. So I think that's what solidified why I wanted to do this. And so I kind of had that in my mind of, okay, this is what I want to do before I apply to medical schools. Not everyone might have that, and that's okay. You can find out what you want to do when you're in it. But if you have this opportunity, because I know that there's now more things, I don't know if it's Hidden Road Initiative or something else, but you go to Armenia and you do some clinical work. I highly recommend that. It's you actually get a lot of work, hands-on experience, and it's really useful actually. And yeah, this is me. If you couldn't tell, that's we're doing a cystectomy, so removing a ovarian cyst laparoscopically. It's great. I love surgery, but I did not want to be a general surgeon because it's not women's healthcare, and I do it for the women. But yeah, that's it. So, any questions? Well, we can open up the floor to questions now, and then I can, if you want, I can go into more detail about DO programs. So whatever you guys want.
I have a question. So OB-GYN is actually a field that I'm really interested in as well. Right now I'm just in my gap year and I'm studying for the MCAT. So I'm like kind of getting into the process, but OB-GYN has always been something I'm interested in. But a lot of people say that OB-GYN residency is like one of the hardest and one of the worst. So I kind of wanted to hear like your input on that.
Yeah, it is one of the hardest. That's not false, but I don't think it's one of the worst. That's really subjective. So, and it also depends on the program, because there are a lot of toxic programs that are still rooted in their old ways of hazing residents and having them work 100+ hours a week, with having only one weekend off a month. So that's not where you want to go. And you kind of figure that out during interviews. So I really got to figure that out when I was interviewing last year. And you could really tell, you can tell from when you're speaking with the residents, their attitudes, even though it's through Zoom, you can kind of get that vibe and go from there. Programs have really changed. The hostility has gone down, especially I believe in like the West Coast and Midwest. Midwest is the best, by the way. They're like the nicest people, obviously, but their programs and education system is also really great. So, I mean, if you get into med school in the Midwest, or if you want to go to med school out there, residency out there as well, I highly recommend it. I didn't, because I wanted to stay in California. So it's just different priorities for people. But I would say it's changed. It is still hard. You have to work really hard. There's so much you need to know. It's a high stress environment constantly, but you get used to it. In the beginning, I started in July, I would go into the labor and delivery floor and I would have anxiety the entire shift, 12 hours. It's just like a knot in my stomach, because you don't know what the hell you're doing. You have no idea what you're doing. You're thrown into the fire. But my program is really great at supporting me, at making sure that I know that I will be okay. And helping you and guiding you and just slowly taking you on that journey with them, instead of bullying you into not knowing what you're doing, or not knowing an answer to the question that they pimp you on. It really depends. East Coast programs, I heard, still are pretty toxic. And I chose not to go there because of that, honestly. So yeah, I mean, some programs still have that toxicity, and but I would say it's still pretty good. And you should go for it. Don't listen to the haters.
Okay. I have another follow-up question, if that's
Yeah.
okay. Like, how is it typically like from what you see, are people able to like start families when they are in residency, especially as a woman in like OB-GYN?
Yeah. So I actually have a co-resident right now who is pregnant. She is a 3rd year. So it's very common nowadays. Nobody will look down on you for starting a family. And they're not allowed to ask you anymore during interviews if you plan on starting that, because it's just not allowed. It's just against the rules. And it's none of their business. It's what you want to do. It's your life. It's your plans. If you think that that's what you want to do, you can do it, but it will be difficult. You still get time off. So you get maternity leave. I think it's like 8 to 12 weeks. I know my co-resident is getting 12 weeks, but I think she's also using her vacation weeks towards it. So I think it's 8 weeks plus the 4 weeks vacation. So you do have to make that up at the end. So the amount of time you miss whenever throughout your 4 years, you have to make it up at the end of your residency, because you need a certain amount of hours and a certain amount of procedures numbers that you need to do to pass, basically. There's no testing per se. I mean, there are, but it doesn't really matter. But you do have to meet those numbers in hours. And so I think that's what kind of gets difficult. But in terms of like doing it, will people support you? Yeah, they'll support you. They can't say anything. No one can bully you out of it. It's really truly between you and your partner and what your plans are for the future.
Great. Thank you.
Yeah.
I think Nora had her hand up right after Sophia.
Oh yeah.
Hi,
What's your
Arjina.
Hi.
Okay, so you said you'd like touch up on DO versus MD if there are like any differences. And then I guess a follow-up to that is, are they both still like, can DO still go into any specialty just like MD? Like, are there like some specialties that they can't? I don't know. I don't really know the difference, so if you could touch up on that.
Yeah,
Thank you.
yeah. So DO versus MD. I know that there's like there was a stigma much bigger than what it is now. When I was applying, I honestly did not care. And that's like my honest truth to you guys. Again, my end goal, like I mentioned, you have to know what your goals are and what your plans are. My end goal was to be a physician and an OBGYN, and I did not care what the 2 letters after my name were. Whatever was going to get me there, I was going to do it. Okay, so I did not care. I researched DOs, and so basically it's just a holistic approach to medicine. You still learn all of the same things that MDs do. Okay, you take all of the same courses. However, you take, I believe, I don't know if it's 100 to 200 hours extra of osteopathic manipulative medicine, which basically, and that's a lot of hours. So we actually had less time to study, unfortunately. But basically, that's just, we had lab that we would go to, and it's basically learning how to use your body to heal itself. And if you are able to believe in that and understand that, it really is true and manifests its ways and in ways that you can't even imagine. Because what you really have to understand is they focus on mind, body, and soul, and it's all interconnected. And sometimes just doing, and it is Western medicine, but sometimes just doing medicine alone does not give you the answers that you want, or it doesn't cure someone. Not that you might not ever have a cure for something, but that's pretty much what it is. So let's say somebody has some, I don't know, kidney issues. However, it's not manifesting as that. It could manifest itself in some musculoskeletal ways, right? It could be a visceral pain that is transferred into a somatic pain, a somatic response. And so as a DO, you're able to put your hands on a patient from day one, get comfortable treating patients with your hands and kind of just feeling what could be going on with someone's body. And there's actually a lot. We look at someone and we don't really understand what's going on, but when you really kind of think about it and you get your hands on somebody, the structure of their bones, the way that their muscles are tensed up can tell you so much about something that might be going on internally as well. And so I think that was my biggest kind of takeaway from why I wanted to go to DO school, and or that I didn't even care why if it was MD or DO. However, I did think that was interesting and I wouldn't mind learning it. There's just different ways of treating diseases. There's different ways of treating back pain and what have you. And in pregnancy, there's a lot of low back pain that a lot of people don't talk about, and we just kind of brush it off. We're like, yeah, it's pregnancy symptoms. You'll have to get over it. You have to basically live with it until you deliver. I kind of don't like that. I mean, if there's ways of treating someone, I want to treat them, and that's OMM, that's osteopathic manipulative medicine. I get my hands on them. I feel their musculoskeletal tissue. I see if there's any inflammation. I see if there's any vertebral dysfunction that needs to be adjusted or corrected, and just like soft tissue techniques. And yeah, I treat their back pain and they feel a lot better. It's not just brushing them off or saying take Tylenol. Sorry, I know that's like a really long answer. It might not have even answered your question, but that's kind of what it is. And if there's a stigma around it right now, no. At least not that I've noticed. I have been rotating and working with MDs since third year, and no one has really treated me poorly because I went to a DO school. They haven't said, oh, you don't know enough as me. No, because you still learn the same things. You take the same tests, you take the same board exams, and you're on the same level. You're on the same playing field. But there are still some people in the older generations, I would say, that still kind of have this preconception about DOs and them not being good enough to be with MDs. But I mean, 2 years ago, ACGME got rid of all DO specific programs, and now DOs and MD residencies are merged into one. So there really isn't a difference. You're really now on the same playing field, and you have the same opportunities as anybody else. You just got to apply, you have to believe in yourself, and you got to work hard. Unfortunately, though, you do have to work a little bit harder than some MD students and MD programs, but I think it pays off. You have to do well on your steps, and it's optional to take your step 1 and step 2, but it's highly recommended because you need to be able to prove yourself and separate yourself from other applicants, and that's with a score again, unfortunately. So yeah, I mean, you have the same opportunities. You can apply to whatever specialty your heart desires, and you can do it. I think our school, Western, had really good match rates this year into specialties all across the board. We even had one girl match into neurosurgery, and there was only one spot offered for residency, and she got it, and she was a DO student. So, you know, you just got to work hard, you got to believe in yourself, and you'll get there. I mean, it's hard, but everything is.
I believe Eliza or Liza had her hand up as well.
Hi, I'm looking to take the MCAT, like a MCAT course next summer for like taking the MCAT at like next September. But I remember you saying like you regretted taking the course, and now I'm regretting it too. But can you go into like why you don't recommend the course?
So for me personally, I don't think it helped much because I think I knew the material. I wasn't a good test taker. And I really didn't become a good test taker until med school and studying for a step and level. But if you think that you need a little bit more help and a little bit more of like a refresher on the material for the MCAT, then I would recommend it because it goes over the MCAT materials, and you go through the questions, the practice questions with the teacher, and he kind of like, or he or she will kind of go over what the questions are asking and what they're looking for. I did not find that helpful. I think what I've come to realize I find helpful for me is just doing a bunch of practice questions and reading the explanations on my own, understanding it, and continuing to do so, because it really is a pattern. It's a pattern of recognition and repetition. You have to be able to do that. That's really what the test is. It's testing you on your endurance and pattern of recognition and repetition, unfortunately. And it's not meant for everybody, and it's not going to determine how well you do in school, in med school. And it's never going to be brought up ever again after you get in. That's why I didn't like it for myself, and I don't want to say I don't recommend it because that might be what's good for you and best for you. But I do highly recommend just buying UWorld now for MCAT and having like one full pass at it and then having another pass at it if you're able to. So that means doing all the questions, going through them one by one, and try to make flashcards out of the questions that you got wrong and go over those every single day until it's really solidified. And I think you'll get there. It's I don't know how similar the MCAT questions are to UWorld now. I wish I did. I unfortunately can't help you with that, but I would assume they're pretty similar because they're really similar they were similar for my steps. Like some questions were even the exact same. So that's what I would highly recommend. But if you want to take a course, I think you should. I mean, I don't want to dissuade you. I mean, you should do what's best for you, but that's why I didn't want to do that. If I had to go back, I wouldn't do that.
Okay, thank you.
Yeah. Any other questions? I know there's some in the comments. Does anybody else have their hands up? Sorry, I can't see who has their hands up or not.
No, I believe it's just a couple questions in the chat.
Okay, let's see. Okay. What were my 2 MCAT scores? All right, here it goes. My first one, which I wish I avoided, I highly recommend voiding if you don't feel like you did well, was a 500. That's just average, I think. And I mean, it's not terrible. I didn't fail it, but it's average. And then my second one, I got a 507. So better. And I think as long as you are able to show that you improved yourself, I think that matters a lot. But I mean, if you're able to get it high on the first try, even better. I mean, you're saving yourself a ton of headache, and it's just get it done, get it over with. But it just really boils down to studying for it correctly. It's a mind game, and to this day, I would say it's one of the hardest tests I've taken. And I've taken a lot of other tests following it. Let me see. What does an allopathic school teach in comparison to osteopathic? So allopathic basically just teaches medicine, Western medicine. So you just learn how to diagnose somebody and how to treat them. And that's most of the time treatment with medications. And there's really no other way for allopathic medicine to treat. But that's pretty much it. I mean, at an osteopathic school, you still learn the same because you have to know how to diagnose every type of disease and how to treat it in a stepwise fashion. You need to know what comes next. You need to know different differential diagnoses and what different things could possibly be. And that's what allopathic schools teach. And you learn a bunch of medications and how to treat them with all these different types of medications, or really just telling someone to go home, ice it, heat it, all of that, but there's not much more than that. And recently, actually, there's been a lot of MD, like older generation MDs, taking courses in osteopathy to get certified. So apparently there's like certification courses that you can take to kind of give yourself some other tools in your toolbox, because I mean, that's basically what it is. I have many different tools in my toolbox and I get to choose if I want to use them or not. And for my future practice, I don't know if I'll be using osteopathic medicine, to be honest, because now that I've been in residency and I see how busy it is and how little time I have in just doing a treatment, because it takes a long time. It takes at least 30 minutes if you want your patient to have some sort of response. And sometimes you don't have time for that, and it's not covered by insurance. So either you charge your patients cash, and that's great. You can charge them as much as you want, but that means your clientele is going to be limited, or you just choose not to do it. Or you don't care about getting paid for it and you still do it. I hope that answered your question.
I have another question.
Yeah.
So I know like for some MD schools, I don't know if this applies to DO, but they have programs where you can get like an MBA during like medical school or like an MPH, I think.
Yeah,
Is
yeah.
that
So I
something
think,
that's like in DO schools as well?
yeah, actually Western has that, and it's a lot. I think we had like 15 students in our class that were coming from that program. So you, patients, sorry, not patients. People in those programs actually have an upper hand and kind of an advantage at getting into medical school at that same school, because the program director knows you. The faculty are basically the same faculty that you're working with for your master's degree and for med school, basically, with very few professors that are different. So yeah, we have that. I believe ours was MPH. I'm not sure, but we definitely do. There are a lot of other programs that do. I believe Kansas City University did. I almost went there, and I know a lot of MD schools obviously have it too. And it's a, I think UCSC has one. Yeah, I think UCSC has one. They all do. Well, not all, but most of them do. And you do get an upper hand at getting in. You have like a better chance of getting into that program, which is why I would recommend doing that if you can. But if not, I mean, it's not really necessary, and you could probably get in without it.
Sorry, so when you say like a better chance of getting in, do you mean like if you're in the MD program at the school, you have a better chance of getting to like the MBA or MPH program?
Oh, you meant like together at once.
Yeah, because like I know
Okay,
some
I
people, like,
misunderstood. Yeah.
I know someone at like USC that I think during her third year, she had some time off, or like their program gives time off to do something else you want. So she decided to pursue like MBA. So that's
Mhm.
what I was asking.
I see. I thought you meant before starting, because we have that before starting med school.
Oh, okay.
I believe so. Still, even with that, I think some programs have it. I'm not sure if a lot of programs have it. I think even for our school, you would be able to do that, but you would have to take time off. So maybe like do like a research year. So you take like a year off to do that instead, which is totally fine. And I think it would look good too if that's really what you want to do. But we don't have an MBA program, but if you want to go anywhere else, you can. I don't see a problem with that, but I don't know if a lot of programs have it, but I don't see why not.
Okay.
Yeah.
So DO schools do, some of them do have that.
Yeah,
Okay.
yeah. Because a lot of DO schools, like bigger programs, have other colleges within it and different programs. So like Western actually has a lot of different schools. So like optometry, dentistry, pharmacy, all of this like together in one. So they have obviously MPH and what have you. And I know that other bigger schools would have even more than that. So yeah.
Cool. Thank you.
Yeah.
Does anyone have any other question for Arjina at all? I know she covered a lot. So if you guys had any questions about anything in particular, just really quickly, I don't want it to take too much of her time since it is 8 p.m. But I do appreciate all of you guys staying. I think it was a very helpful talk, and I personally learned a lot because, you know, I feel like a lot of us are still wavering between going after medical school or maybe another path. So getting honest advice is always helpful rather than people being like, oh, it's worth it, do it, do it, do it, you know. It's
Yeah, no,
very
I'll be,
appreciated.
yeah, of course, I'll be honest with you. I mean, yeah, I was still on the fence too when I was in undergrad. I kind of thought about becoming a PA, but then, like I mentioned, you have to realize what you want to do. I wanted to do surgery. I wanted to be an OB. So I wouldn't be able to, I mean, I would be able to do it to a certain degree, but I wouldn't be able to do it to the fullest extent. And it's okay. It's okay if you don't go to medical school. You kind of have to get that out of your mind that like it's kind of just like this societal, even like Armenian like generational like pressuring, and you have to realize what's best for you because you're going to be the one that's going through it, suffering. I'm kidding, but yeah, it's all for you.
Yeah, I definitely agree. I think in our culture, like one thing I really like about these events is that you can get like the input of people saying that like, oh, I did go to medical school. Some people saying they didn't go to medical school, but whether you did or didn't, like our cultural norm of that is the highest level of like achievement. Like we need to get that out of our heads. So I definitely agree with that.
Because we all, at the end of the day, also, we all work together as a team. I really appreciate all the help I get from my nurses, from my PAs, NPs. Like it's really a team effort, and I learn a lot from them. They learn a lot from me. So it doesn't matter. It's preference.
Definitely.
Yeah.
All right. If no one has any further questions, thank you once again, Arjina.
Thank
that
you
was a
guys
great
for
talk.
coming. If
Thank
you guys want, I can leave my email, and anybody who wants to can reach out to me. Let me see. I have like a million emails. Okay, that's my work email. So you can jot that down. I put it in the chat. And yeah, thank you guys for doing this. Like I said,
Thank you so much.
Thank you.
yeah. Oh, I direct
you.
messaged it. Sorry.
Great. Thank you so much, and I hope you have a really good night.
Thank you. You too. Good luck on everything.
Thank you for your time.
Of course, you guys. Good luck.